There's a rift in the Democratic Party about how sweeping the next steps in health care reform should be, but it's a long, bumpy road between that debate and actually implementing a plan. Meanwhile, in the month following the release of her health plan, Sen. Kamala Harris v. Caliph, has taken a bruising from her critics who say her proposal is based on political calculations rather than conviction. Bloomberg, all the Democratic health care proposals have one big problem, but looming in front of the discussion is an obstacle no amount of careful messaging will help them overcome. Even the most modest Democratic plan would face intense opposition from health-related industries, not to mention Republicans. Already, powerful interest groups are mobilizing and pooling resources to undermine the Democrats' plans. The Partnership for America's Health Care Future, a lobbying group that represents insurance companies, drug makers, hospitals, and other industry players, is running TV ads and commissioning polls designed to undercut support for any expansion of government-provided coverage. Capper, 8/23, The Associated Press, Democrats take a look at a practical health care approach. Democratic voters appear to be reassessing their approach to health care, a pragmatic shift on their party's top 2020 issue. Medicare for All remains hugely popular, but majorities say they'd prefer building on Obamacare to expand coverage instead of a new government program that replaces America's mix of private and public insurance. Price and Alonso Zaldivar, 8/23, Politico, Kamala's rivals seize on health care stumbles. Kamala Harris offered her health care plan expecting to bridge the party's divides and decisively answer doubts about her seesawing positions. But in the months since, the California Democrat is still struggling to rebut attacks from her chief rivals who are poking holes in its specifics and accusing Harris of putting political calculation before true conviction. Joe Biden's campaign dismisses it as a have it every which way plan, while Bernie Sanders' camp ripped it as cobbled together to address various poll numbers. Catalogo and Diamond, 8/20. Politico Pro, Democrats' health care split squeezes Senate contenders. The major battleground state Democrats running to flip the Senate want nothing to do with Medicare for all. In states like Arizona, Iowa and North Carolina, challengers Mark Kelly, Teresa Greenfield and Cal Cunningham are staying tightly focused on the health care message House Democrats used in 2018, expanding Medicaid, protecting Obamacare and slamming Republican repeal efforts. Bolstein and Arkin, 8/23, and in other 2020 news, Politico, fact check, did Bernie just backtrack on Medicare for all? Speaking to labor officials in Iowa this week, Bernie Sanders unveiled a new twist to his Medicare for All plan. His centrist Democratic rivals pounced, accusing the original champion of government-run health care of softening his signature policy in order to placate angry union members. Nonsense, his campaign responded. So what's the deal? Bolstein and Otterbein, 8/20, The Hill, Gillibrand unveils mental health plan. Sen. Kirsten Gillibrand, DNY, unveiled her plan to improve mental health care in the U.S. This week, arguing that the issue demands more attention from leaders, the Democratic presidential candidate wrote in a Medium post on Tuesday that she plans to invest in community-based approaches to mental and behavioral health, personalized the way the U.S. delivers mental health care and require insurance coverage for mental and behavioral health. Manchester, 8/20, Politico Pro, how Pete Buttigieg would tackle the mental health and addiction crisis. Democratic presidential candidate Pete Buttigieg on Friday unveiled a $100 billion plan to expand access to mental health and addiction treatment that coincided with a campaign stop in Manchester, New Hampshire, a state hit hard by the opioid crisis. The wide-ranging plan calls for integrating treatment into primary care settings, increasing the number of available treatment beds, making it easier for patients to get access to medication for opioid addiction, investing in suicide prevention for veterans and addressing disparities in behavioral health care. Ellie, 8/23. This is part of the KHN Morning Briefing, a summary of health policy coverage from major news organizations. Sign up for an email subscription. Let's block ads. Why?